Hi, this is Dr. Witten, founder of the Witten Method, and this video is specifically for chiropractors. You know, us chiropractors, we talk about the innate intelligence, and it's kind of a slogan, but how do you listen to the innate intelligence? How do you use that knowledge in your treatment? You know, most chiropractors are doing quick treatments. They go in, they adjust, they pop everything that will move and call it a day. But how do you know that that's what the patient's body wants? So if you like this video, give it a thumbs up and subscribe. I upload valuable content all the time, so if you hit the notification bell, you'll get notifications, obviously, when we upload videos. So today I wanted to talk about how you can find subluxations using muscle testing without having to palpate. And so this idea of what the patient, what their body is wanting, what their innate intelligence is requiring for healing, how do you access that intelligence? You can't feel that with palpation. You can't see it. Unless you're psychic, you don't know that information. So muscle testing is kind of a trick or a tool for accessing innate intelligence. So the question is, what am I being invited to do? Does her body want or welcome or invite an adjustment? If not, what does it need? There might be soft tissue issues that need to be addressed first in order for the muscles to be relaxed enough for an adjustment to go deeply. There might be nutritional issues. There might be stress and other emotional issues that need to be addressed. So I'm just going to give you a quick overview of how you find subluxations using muscle testing and how to know what we're being invited by her innate intelligence to do. So if I take an arm and just using her deltoid as an indicator muscle, see if we say a true statement, her muscle holds strong. We're in Santa Barbara, her muscle holds strong. We're in China, goes weak. Okay, so it's a simple yes-no phenomenon. So if I say, is her body inviting me, or does her body want me to do an adjustment now? Yes. So I know I have an invitation to do an adjustment. Where? Not in the head. Sometimes we can do cranial work. Not in the neck, not in the upper thoracic. So I'm invited to do some adjustment in the upper thoracic. Not left T1, 2, 3, left T4, 5, 6, right T1, 2, 3. Okay, so I know I'm invited to do some adjustment right upper thoracics. And in my workshop, I go into greater detail of how to do this a lot more precisely. But I'm just kind of showing you how you find the locations. And then in my Module 1 Witten Method seminar, if you're interested in taking that, I go into greater detail into how to find things like what phase of breath to do the adjustment on, how much force to use, if there's an emotional component included with that adjustment, and how you incorporate that with the adjustment. But for now, we'll just show you how to find subluxation. So right T1, right T2, right T3. All right, so we'll go in there. And how do we know exactly when we're on the point? We can test, hold strong, hold strong. There we go. Okay, right there. And went very easily. 2 little pops. Okay, so we were invited to do that adjustment. That might be the only adjustment her system's inviting me to do at this point in time. Am I invited to do other adjustments? Yes, not in the neck, not left T1, 2, 3, 4, 5, 6, right T1 through 6 through 12, left lumbar, okay, left L1, left L2, left L3. Okay, so let's go on the side here. I like to use the bicep muscle test. Obviously, patients don't have tattoos, L1, L2, L3, so just to pinpoint with surgical precision exactly where L3 is, here's the PSIS, here's L5, so somewhere around here, so a muscle test. Right there, there's L3. Pull her a little closer, hips a little closer, bring the knee way up into your chest. There we go, got it effortlessly. Alright, hold, hold, hold. Is there another adjustment we're invited to do? Right L1, 2, 3, 4, 5. Right sacrum. Right S1. Right S2. Obviously the sacrum is just one fused bone, but with the muscle testing we can identify the best leverage point to do that adjustment. Also in the seminar we'll go into the phenomenon of two pointing. Drop your arm. So let's say we find, hold strong. I'll just give you a quick sneak preview of that. So we got a weakness at S2, and then if I vector down, it stays weak, indicating that that didn't fix the problem. I'll push down at about 5 o'clock. No good. 4 o'clock. 4 o'clock. Okay, so now we know the ideal vector of correction. Okay, so we'll go in there. There we go. So this helps your adjustments be laser precise. All right, let's see, anything else? Am I invited to do any other adjustments? No. Okay, I would have guessed maybe something else in the pelvis and in the neck. But if I say, hey, am I invited to do other adjustments right now? Her system says no. The beauty of muscle testing is it enables us to listen to what her system wants at any given moment. Shall we do soft tissue work now? Yes. Okay. Her system wants to do some soft tissue work. Where? Not in T1 through 6 through 12, lumbar, pelvis, C1, 2, 3. So before we adjust the neck, it's requesting soft tissue work. What kind of soft tissue work? Not massage, not fascia. Right posterior, posterior lateral, right anterior, C3, left posterior. Fascia up, fascia down, so it wants to be stripped down. So in my workshop I go into this with a lot more detail, but just so you see, this is truly what it is to listen to the innate. Okay, so we get to C3, okay, and it says the fascia wants to be stripped down. Her body told me that without me palpating. So this enables us to access a much higher quality of information than we can get through palpation or visual feedback. And so we'll strip the fascia there. I don't really have any fancy fascia release techniques. I just find the vector and work that in that direction. Okay, hold, 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 fascia. Okay, so now it's strong. Am I invited to do an adjustment now? It says no. Probably want some other soft tissue work. So this takes a little longer. If you have a 2-minute adjustment practice, this isn't going to work for you. But if you're interested in deep healing. So I've been teaching the Witten method for lay people as well as healthcare professionals. So module 1 covers structural correction, and it's for everyone, but I've made a special segment just for chiropractors. So if you want to get that, I have a special part that goes into detail about how to do precise adjustment work. And if you're not a chiropractor, you can still benefit greatly from Module 1, where we go into detail on how to do very precise soft tissue work. If you're a massage therapist or work with the body like a Rolfer, I show you how to find and correct fascial restrictions, trigger points, adhesions. And so if you like working with the body in a physical way, Module 1 would be great for you. If you're interested in learning that work, just email me, and have a wonderful day.